My name is Karen Brodchek. I'm in Marketing Communications with Ecolab, and today we have our final 2018 webinar for 2018. The topic is flu prevention. It's a topic that we've heard a few times that people have wanted to hear about, so we've added it to our calendar this year. Our speakers today are Dr. John Hanlon. He is the Vice President of Food Safety and Public Health at Ecolab, and Chris Schultz, Marketing Manager for Hand Hygiene here at Ecolab. But before we get started, let's have a short video about flu.
In play, a child knows no boundaries. Neither does the flu. The flu does not respect age, or geography, or the many places we gather. So wherever you are in life, or the world, whomever you may be with, whether you're on the job or surrounded by friends, protect yourself and your loved ones against influenza this season, because life is precious in all its stages.
And with that, I will be turning the floor over to Dr. Hanlon.
Well, thank you, Karen, and good morning, everyone. Over the next 20 minutes, I'm going to talk about seasonal influenza, or the flu. It's a very serious viral infection that infects millions of people every winter and kills between 12,000 and 56,000 people in the U.S. annually. Over the next 40 minutes or so, we'll take a look back at past flu seasons, discuss the upcoming flu season, and then my colleague Chris Schultz will discuss strategies to reduce influenza infection risk for your customers, your staff, and yourself. Following our closing remarks, we should have some time for Q&A. So here are the key takeaways. Flu continues to be a major public health threat. It sickens millions, results in several 100,000 hospitalizations, and can kill thousands of people each year, depending on the severity of the flu season. Flu can also have a significant impact on both your staffing and your business overall. There is some good news, however, because there are strategies that you can employ to reduce infection risk, and I'll be highlighting them in a few minutes. So what is influenza? It is a severe respiratory illness caused by a virus, the influenza virus. Before I get into some detailed facts and figures about the flu, I'm often asked about the difference between colds and the flu. So, the common cold and the flu are both respiratory diseases caused by viruses. However, the flu, as I mentioned, is caused by the influenza virus, while the common cold can be caused by one of over 200 different viruses. For example, rhinovirus is the most common type of virus that causes the common cold. It can be very difficult to tell the difference between a cold and the flu, but in general, the flu is much, much worse than the common cold. Fever and extreme tiredness are common characteristics of the flu. Dr. Rob Hicks, a UK physician, perhaps put it best when he said, and this relates to British currency, if you can't lift a 10-pound note off the floor, it's the flu. Another question that I'm often asked is the difference between seasonal flu and pandemic flu. So this chart shows the similarities and differences between the two. Let's start with the word pandemic. A pandemic is an epidemic infection that spreads globally. Pandemic influenza occurs when a non-human influenza virus, 1, gains the ability to infect humans, 2, develops the ability for efficient and sustained human-to-human transmission, and 3, spreads globally. For both seasonal and pandemic influenza, the total number of people who get severely ill can vary, but the impact on morbidity and mortality for pandemic flu is much higher. The last pandemic flu was in 2009, and it was thought to have killed between 151,000 and 575,000 people globally. In terms of similarities, the points on the left-hand side of this slide summarize them well. As to differences, there are some very important differences shown on the right-hand side of this slide. Initially, we have little or no natural immunity to a novel strain, and we don't have a vaccine against it. A new strain may be more pathogenic than strains that we've been exposed to before. It may be more contagious, infect more people, and impact broader age groups. But to alleviate any concerns that people may have, we are not in a pandemic flu situation at this time. As I just mentioned, the last pandemic flu was in 2009, and there have been 4 pandemic flu outbreaks over the past 100 years. So what do we know about seasonal flu and when does it occur? As I mentioned, the flu is a serious, potentially life-threatening respiratory viral infection. Each year, millions of Americans are infected with the flu, resulting in hundreds of thousands of hospitalizations and between 12,000 and 56,000 deaths from flu and flu-related complications. Total morbidity and mortality, or illness and death, depends on the severity of the flu season. It will probably not surprise you that young children and adults 65 years or older are much more susceptible to the flu. About 70% of flu-related hospitalizations and 85% of flu-related deaths occur in people 65 years or older. So let me just repeat what I said in the previous slide. About 70% of flu-related hospitalizations and 85% of flu-related deaths occur in people 65 years or older. A weakened immune system makes the flu a much more serious problem for people over 65 years of age. In addition, chronic health conditions can further increase the risk of influenza infection and health complications arising from the flu. I mentioned that young children are much more susceptible to the flu because their immune system is still developing. Last year, children under 5 years of age accounted for about 35% of pediatric deaths related to influenza. The U.S. CDC estimates that since 2010, flu-related hospitalizations among children younger than 5 years have ranged from between 7,000 and 26,000 in the U.S. I think many, if not all of us, can relate to flu symptoms. They include fever, muscle ache, headache, a non-productive cough, sore throat, and nasal inflammation. I've also noted additional symptoms that can occur in children. In regards when a person is infectious, it is often 1 day prior to showing symptoms and up to 7 days after symptoms first appear. The flu is transmitted from person to person when the flu virus, contaminated droplets, go from one person's mouth or nose and land in the mouth or noses of people who are nearby. These same contaminated droplets can be inhaled into the lungs of a person and cause illness. So if you start to think about how flu-contaminated droplets can infect a person, you'll appreciate that infection can occur directly from person to person and indirectly by touching an object that an infected person has touched or contaminated with their droplets, like a door handle, a light switch, perhaps a keyboard used by multiple people. The flu virus can also be transmitted through the air, and airborne transmission is possible from one person to another over a distance of about 6 feet, through coughing, sneezing, and even talking. Now that we've described the modes of transmission, let's turn our attention to how long the flu virus can survive and be infectious on various surfaces. You can see from this slide that the flu virus can survive on plastic and stainless steel for 1 to 2 days and can be transferred to hands for up to 24 hours. So think about that surface or high-touch object that you just touched. Did someone with the flu sneeze or cough near that surface within the last 24 hours? The flu virus survives for shorter periods of time on cloth, paper, tissues, and can be transferred to hands for up to 15 minutes. And so because it can survive for different lengths of time, and since you really don't know if you or your staff have touched a flu-contaminated surface or an object, it is especially important to increase frequency of disinfection and hand hygiene, especially during the winter season. Since influenza A can survive on hard surfaces for 2 days, here are a couple of very simple tips. Wash your hands frequently with soap and water, and use alcohol-based hand sanitizer. So let's transition to the flu season. Let's look back and look ahead. First, let's take a look back at past flu seasons. This bar chart shows the distribution of months when flu peaked in the U.S. over the past 35 years. About 50% of the time, flu peaks in February. But as the chart shows, flu can peak anytime between October and April. You can see when flu peaked for 3 of the last 4 seasons. Each year, it peaked during a different month. Now think back to last year's flu season. When did it peak? It peaked in the mid-January to mid-February timeframe. So when you look at when flu peaked over the past 4 years, it really mimics the 35-year trend that flu can peak, again, anytime between October and April timeframe. Last winter's flu season, so the 2017-2018, was one of the worst in the last 10 years. In fact, the CDC has stated that last winter we saw, and I quote, record-breaking levels of influenza-like illness and hospitalization rates. The chart at the foot of the page shows levels of influenza-like illness in 2017-2018 compared with the last 6 years. And you can see that the peak is much higher than in most previous years. And just within the last day, I've seen the 2017-2018 burden of illness that the CDC released in regards to flu. According to the CDC, and I think this was just posted within the last 24 to 48 hours, the burden of flu diseases in 2017-2018 was that there was an estimated 49 million flu illnesses during last year's flu season. And that's more than the combined populations of Texas and Florida. The CDC further estimated that there were about 960,000 hospitalizations and tragically about 79,000 deaths related to flu and complications from the flu. We see a similar picture in Canada. Canadian officials estimate that about 12,200 hospitalizations occur because of the flu each year, and there are about 3,500 deaths. Canada's National Influenza Surveillance Program publishes flu maps throughout the season. I pulled this map from the 4th week of January of 2018, and it shows widespread flu activity in Ontario and throughout a number of other provinces. So take a look at this histogram. You'll see that the peak of flu season in Canada extended from late December for nearly 3 months through mid-March. Influenza type A predominated in the early part of the flu season, but we also saw high levels of influenza B as well. So what about the upcoming flu season? We can't predict how severe the season will be, but public health officials do track what influenza strains are circulating. In fact, it is this kind of surveillance that public health officials use to determine how flu activity is trending, and they also use this information to select the flu strains for next year's flu vaccine. The bottom line on this slide is that we simply don't know how severe the upcoming flu season is going to be. Like so many other infections, there are ways to help reduce the likelihood of an infection and things we need to do in response to an outbreak. And I think the images here are good examples, and it reminds me of the adage that an ounce of prevention is worth a pound of cure. Intervention measures to reduce flu risk fall into two broad categories: pharmaceutical approaches and non-pharmaceutical approaches. The pharmaceutical approaches center on flu vaccination and treatment of people who have the flu. Non-pharmaceutical approaches center on washing hands frequently, using alcohol-based hand sanitizer, cleaning and disinfecting surfaces, thoroughly washing tableware, covering your nose and mouth when sneezing and coughing, and avoiding others who are sick. So with flu season approaching, now is the time to prepare and focus on flu prevention for your customers, your staff, and yourself. We've captured our recommendations in our 7-tip flu icon. So starting at the top of the hour and moving clockwise, they are washing hands frequently, using alcohol-based hand sanitizers, avoiding others who are sick, cleaning and disinfecting surfaces, an annual flu shot, covering your nose and mouth when sneezing and coughing, staying home when you're sick, and thoroughly washing tableware. I'll now turn it over to Chris, who will focus on the business and staffing impact that flu can have and additional information on our tips to reduce flu risk.
Great. Thank you, John. So as Dr. Hanlon pointed out earlier, influenza is a serious public health risk. It has a huge impact on our businesses. If there's anything you take away from this webinar today, we hope that you understand the impact seasonal human influenza can have on you, your employees, and your business. Last year was a record-breaking year for the impacts from the flu, just like John mentioned. Here's some statistics from the CDC that show the scale and the impact the flu has on our business. Right? Just think about this. On average, 36 million Americans get the flu every year. But like John just mentioned, last year was a record year with 49 million Americans. Again, on average, 900,000 are hospitalized annually. And those are big numbers. But what does that mean to you? When an associate or when one of your employees gets the flu, he or she spends almost 2.5 days in bed, misses almost 3 days of work, and is sluggish for another 2.5 days upon return. All right, so here's the bottom line. If one of your employees gets the flu, you basically lost a week's worth of work due to the flu illness. So to reiterate that point, when we put that impact into dollars, $16.3 billion per year in earnings are lost. $87 billion in total economic burden is experienced across the economy. Caregivers of children with the flu lose, on average, 73 hours of work time if the child is hospitalized. And just think about that. You can see the impact that flu has on our businesses, so it's critical that we all pay close attention and adopt specific practices to reduce the risk of flu. We're going to talk about those practices today. So you recall these flu prevention strategies that John covered a minute ago. I'm going to talk through the 3 or 4 non-pharmaceutical interventions that he mentioned: hand hygiene, surface cleaning and disinfecting, and thoroughly washing tablewares. I'll give a quick overview of each and then cover ways that you can implement these strategies in your workplace. So with those prevention measures in mind, here are some steps you can take now at the very start of the annual flu season to protect yourself and your employees. Now keep in mind that these next recommendations are really targeted towards building owners or managers and supervisors. So if you yourself are not in a position to implement these recommendations, I'd highly encourage you to share these tips with someone in your organization who can. So first, with respect to hand hygiene, you want to make it easy for people to do. This starts with making sure your facility provides products that are gentle on hands, especially with repeated and frequent use. No one wants to use a product on their hands that is harsh and leaves their skin dry and cracked over time. You also want to consider placement of hand sanitizers, making them easily accessible for people in your facility to use. Next, with respect to cleaning and disinfecting of surfaces, work with cleaning staff to establish a frequency for cleaning tasks and provide guide cards that clearly show high-touch surfaces and provide guidelines for how frequently they should be cleaned and disinfected. Now, with both of these, you want to be sure to advertise and promote proper steps, proper procedures within your facility, and provide reminders to people about the importance of hand washing and cleaning and disinfection of those surfaces. Right, in our work, we've found that customers and staff are receptive to overt signs and messages that cleaning is an important step in keeping their environment clean, safe, and healthy. Everybody appreciates reminders every now and then, right? I know I do. Proper hand washing is a critical prevention step. Our hands are how we interact with our environment. They are what we touch things with. So think about touching a sick individual or touching an object like a tabletop that a sick person may have coughed over and then later itching your eye. Right? This is a great example of how the virus can be passed from people to objects and back to people. So to break that chain of transmission, you need to practice frequent hand washing with proper procedures. And by proper procedures, I'm not talking about the splash and dash either, where you quickly rinse your hands underwater. Proper hand washing procedures recommended by the CDC are first wetting your hands with clean running water, then applying soap, then lathering the soap by rubbing your hands together, taking care to wash the palms, between your fingers, the backs of hands, under the fingernails, really doing a very thorough job scrubbing all of the surfaces of your hands. Now, it sounds funny that we're telling you how to wash your hands, but this is really a critical step in the prevention of influenza and other illnesses. The CDC recommends this process take at least 20 seconds, or about the amount of time it would take you to hum the Happy Birthday song from beginning to end 2 times. So once you finish the scrub, you then want to rinse well under clean running water and dry your hands with an air dryer or a clean towel. Use a disposable towel to turn off the water so you're not touching the faucet again after you've washed your hands. The CDC also recommends the use of an alcohol-based sanitizing hand rub, or what we may refer to as hand sanitizer. Like I mentioned, it's important to make them easily accessible for people in your facility to use. Studies show that if products are easily accessible and available, they get used more often. An important note here is that prior to use of an alcohol-based hand rub, your hands must be visibly clean. If there's visible dirt or soil, you need to remove it by properly washing your hands with soap and water like I just described, as the soil could reduce the effectiveness of the hand sanitizer. You should only use an alcohol-based hand sanitizer if your hands are visibly clean. The best way to apply hand sanitizer is to apply the product to the palm of your hand and then rub your hands together until dry so that the product covers your palms, fingers, and the backs of your hands. Basically, again, doing a thorough job to ensure the product contacts all the surfaces of your hands. You need to use enough product so that it takes about 15 to 20 seconds for your hands to dry. If your hands dry faster than that, then you're probably not using enough product and you may not be getting the sanitizing effect you desire. You can try to hum the Happy Birthday trick here as well. So just as we talked about at the beginning of the webinar, hands and surfaces are both known culprits in the transmission of flu virus. So in addition to properly cleaning our hands, we also need to properly clean and disinfect surfaces. Cleaning and disinfecting surfaces is an important step in reducing the number of microorganisms, including the flu virus, that could be on the surface. It's a key step in reducing the potential that the next person who touches that surface will pick up virus particles and then infect themselves when they touch their mouth, nose, or eyes. And just as with hand washing, proper procedures are key. Remember, you want to clean and disinfect the surface. While we can clean without disinfecting, we cannot disinfect without cleaning. So the first step is to make sure the surface is clear of any organic matter. Any soil on the surface could potentially inactivate the disinfectant or shield that virus particle from the disinfectant. If there's visible soil, one option is to use a combination disinfectant cleaner product for both the cleaning and the disinfecting steps. You can tell if your product is a disinfectant cleaner by reading the product label and looking for terms such as one-step disinfectant cleaner or perhaps cleans and disinfects in one step. In the United States, disinfectant products are registered and regulated by the U.S. Environmental Protection Agency, or the EPA. So you want to be certain to use a product that is EPA registered, meaning the label has an EPA registration number on it. You also want to look to make sure the product has claims against influenza. This can be found in the section of the label that lists what organisms the product is effective against. Now, you also want to be sure to read the label section that covers instructions for use to ensure you are using the product properly. As with hand washing, proper product use and proper cleaning procedures are so important to making sure your efforts spent cleaning and disinfecting are effective in helping to prevent transmission of the flu virus. So my final tip here centers on thoroughly washing tableware. The flu virus can easily contaminate plates and utensils, and these can become vectors for infection. So if you're using a machine for ware washing, make sure that dish machine is functioning properly. Make sure the temperatures meet the minimum requirements and the chemical concentrations are correct. For manual ware washing, remember the 3 essential steps: wash, rinse, and sanitize. So in addition to hand hygiene, properly cleaning and disinfecting surfaces, and thoroughly washing tableware, there are other steps you can take as well. As previously mentioned, for the flu to be transmitted, the virus has to go from an infected individual to a new susceptible person who can then become infected. You can reduce the risk of this sort of transmission by staying home when you're sick and by avoiding others who are sick. These are known as social distancing techniques. If you are sick, it's important to cover your nose and mouth when you cough, either by using a tissue or by coughing into your elbow to trap the virus particles and prevent them from becoming airborne. And finally, get your annual flu shot. Vaccination remains the best protection in preventing yourself from becoming infected with the flu. So as we think about implementing those strategies in the workplace, with respect to vaccination, you want to make it easy for your employees to do it, like providing them time to get vaccinated or by hosting a vaccination clinic at your facility. Additionally, find ways to make it low cost or no cost so that cost is not a barrier to that vaccination. Many health plans cover preventative services such as vaccination in full. It's also helpful to advertise and to promote getting your flu shot through posters and other promotional materials in the workplace. Next, with respect to social distancing, as an employer, you have a lot of influence over this through your sick leave and attendance policies. You don't want a sick person coming to work as they are likely to then transmit the flu to their coworkers. Again, you want to advertise and promote your policies so that employees know it is okay to stay home and, in fact, are encouraged to stay home when they're sick. And finally, regarding cough etiquette, you want to make people aware of proper cough techniques. The poster shown on the slide is an example of a poster that can be displayed in your facility. It shows how to properly cough into your elbow or tissue instead of your hands to trap the virus particles. This poster also reminds people to properly dispose of the used tissue and then to perform proper hand hygiene practices. So now that we've reviewed these steps you can take back with you to implement within your facilities, how can you get help to implement them? I'd encourage you to reach out to your suppliers to see how they can assist. Your suppliers can provide flu prevention information, including promotional materials, reminding facility users about important things like hand washing or coughing into your elbow. Your supplier can also help you select hand care products that are gentle on hands, as well as dispensers that make hand sanitizer accessible and easy to use by building occupants. We found that engaging graphics that communicate the importance of good hand hygiene is also helpful as well. And lastly, Suppliers can provide educational training for your staff, your students, your residents, or tenants. I would encourage you to not be shy about asking your suppliers' representatives for help proactively working to prevent the spread of flu in your facility. So we're nearing the end of our webinar, so I'll leave you with some closing comments. This image summarizes the 7 steps to reduce the influenza risk. And remember, the critical steps we discussed are proper hand washing and hand hygiene techniques, cleaning and disinfecting surfaces, and thoroughly washing tableware. You can find additional information on these flu prevention solutions and on the flu in general at these websites shown here. These websites are a great starting point for general flu facts, information, and solutions that you can use. If you're interested in organisms other than the flu, I'd encourage you to check out our virus primers, where we provide overviews of various viruses of interest, such as influenza or norovirus or measles and others. This is an area of our website that John works very hard to keep updated and current to make sure we are providing information on organisms of interest. And lastly, I'd like to call out the CDC website as a resource, and we encourage everyone to refer to it for public health-related information. The CDC provides a wealth of information related to the flu, including stats of the current flu season and tips for prevention. Here we've provided 2 links. One, the CDC website for flu season we are now entering, and a second, which is specifically targeted to long-term care employers. We know that several of you on the call represent long-term care facilities, so we want to make sure you're aware of this toolkit as a resource. Now with that, we've reached the end of our webinar, and we'll open the floor for questions. As a reminder, to ask a question, please use the Q&A feature for the webinar to type in your question.
Great. Thank you, Chris and John. We have had quite a few questions come in, so I'm going to just kind of try to filter through them and maybe pull some of them together that might be alike. Chris, I'd like to start out with one specifically for you, because you just ran through a bunch of tips, and we had one that came in while you were going through those. Is, you know, in a food service establishment or a food establishment, what has been some of the most successful mediums for flu prevention and mitigation strategy in terms of just the messaging? Is it the posters? Is it social media? Is it team meetings? What have you seen that works best?
We highly recommend anything that's going to keep it in front of your employees on a consistent, frequent basis. So posters around the facility, in the kitchen, in the back of house, in the restrooms that are going to remind employees on proper procedures for hand washing techniques. So these procedure posters can help inform them on the best procedures that they can use to help prevent the spread, protect themselves, the other coworkers. We'd also recommend signage out in the front of house, out in the front of the restroom or the restaurant. Take a hand sanitizer stand, for example, or a dispenser, for example, that can have graphics applied to it to communicate your message and help customers feel comfortable using hand sanitizer that will be placed out in the front of house in the restaurant.
Another just on the food service segment, John, this one is perhaps for you, is can food serve as a source of flu transmission? We talked a lot about different ways that the flu is transmitted. Is food a way?
Yes, so it's a great question. I haven't seen anything in the scientific literature that indicates that food can be a source of transmission. But being in food safety and public health, I've learned that never to say never. And so is there the potential? Possibly, but it is not, repeat, not the primary source of transmission.
Great. Another thing I mentioned about cleaning surfaces, what's the contact time that's important for surface disinfectants? Chris, that one's probably for you.
I would start by saying not all disinfectants are the same. It's really important to read the label or the product information sheet to understand what that disinfectant is effective against, what its claims are, and what the time is in order for it to be effective against those claims. So always read the product label. It's going to be different for different types of disinfectants. That's going to be your best resource.
We get a lot of questions about the use of gloves. gloves, and is it a way, can gloves serve as a way to help protect against the flu?
I would say the best method for protection is going to be proper hand washing. Gloves are going to give you a disposable medium for when you're transferring or shifting between jobs in the kitchen, but it does not replace proper hand washing as a preventive step. Proper hand washing is going to be the best form of prevention for you to take, and gloves should not replace that step.
And when you talk about hand washing, is hot water better than cold water for properly washing hands?
Water temperature isn't going to matter. You're going to want to use temperature that is going to be comfortable and encourage staff to wash their hands at the frequency that they should be washing. The most important part is going to be the scrubbing for 20 seconds to ensure that you're getting the proper lathering and removing the virus particles from your hands. So the most important part is going to be the time. We talked about humming. The happy birthday song is a technique. Humming it twice to measure that amount of time. That's going to be the most important step. Warm water is going to make it a more pleasant experience for your employees, therefore encouraging them to do it more often and at the times they should be doing it.
We've had a couple people who have asked to have the resources put back on the screen, so while we continue with the questions, I'm going to flip back to those slides so that folks can see those. So one of which was the long-term care one here. So just continuing on kind of with the best practices with hand washing, do you have to use antibacterial soap or will regular soap suffice? John, do you want to take that one?
Yeah, I'd be happy to answer that one. So the question is, do I need to use antibacterial soap in regards to influenza? The answer is no. Regular soap and water is just fine. Remember, the influenza is a virus, not a bacteria. And an antibacterial soap is for killing bacteria, so regular soap and water is perfect. And remember from one of Chris's slides, that is that hand washing is not a splash and dash. The proper procedure is to wet hands with clean running water, apply soap, rub hands together, lather the soap, cleaning the backs of hands and between fingers, and then rinse well under clean running water and dry them with a paper towel.
Just shifting a little bit from the food service segment, we want to talk a little bit about some questions that have come in from a lodging or hospitality segment. So one person has mentioned that they work as a front desk manager at a mid-sized hotel. And how do I make alcohol hand gel available not just for my colleagues but also for my guests? Chris, could you take that one? The centers of availability and contents of every location?
Yeah, absolutely. So hand sanitizers come in different sizes, different forms, and that is to make it convenient so you can be placed throughout a facility. You can have large bottles available on tabletops or counters. You can have small bottles available for your employees and staff to take with them, place in their purse or their pockets. You can have hand sanitizer stands placed out in a front lobby, so it is greeting folks as they come in the door or are transitioning between different rooms. So we have different sizes and different methods of dispensing the product so that it becomes convenient and easy for the staff to do whenever they need to. The beauty of having hand sanitizers is that you don't need to have it near a sink. You can place them anywhere across your facility.
Let me see here. Are the flu statistics proportionally similar for Canada?
Yeah, I'll take that one. John Hanlon here. That's a great question. Flu statistics are proportionally similar for Canada and likewise in Europe.
Another question that we often get, especially at this time of the year, is the difference between norovirus and the flu. Does the norovirus present like the flu, and what's a good cleaner to use with this? That's probably one you might need to tag team.
Yeah, why don't I start off, and then we'll turn it over to Chris here. So what is the difference between norovirus and the flu? So norovirus causes acute gastroenteritis, and that results in vomiting and diarrhea. So norovirus is a gastrointestinal infection, whereas the flu is a respiratory infection. What's interesting is that while we're coming in towards flu season, we're also coming into norovirus season as well.
So norovirus, for me, it presents itself like you might call it a stomach bug or stomach flu as opposed to an entire body flu. That, to me, has always been the kind of the clear indicator of what it is. And frankly, the same mitigation techniques that we've discussed in this related to influenza apply to norovirus as well. The hand hygiene techniques that we discussed, surface cleaning and disinfecting, making sure we are thoroughly washing, cleaning tablewares to help break that chain of transmission as well. Those would be the recommendations for norovirus as well. John, anything else to add?
Yeah. One thing to remember, while they're both viruses, they're both very, very different viruses. Influenza is an enveloped virus. Norovirus is a non-enveloped virus. And with respect to disinfectants, and this gets to something that Chris was mentioning, not all disinfectants are created equal. And the influenza virus being an enveloped virus is much easier to kill with disinfectants than norovirus. There are many disinfectants that are effective against influenza. There are also many disinfectants that are effective against norovirus. That's why it's so important that when you think about the products that you're using or the products that you're going to use for disinfection, that you check the label, because it may not be that a disinfectant that carries, if you will, an EPA claim against influenza, that same disinfectant may not be effective against norovirus. So again, check the label or contact your supplier, and they will have all of that information.
Great. Well, thank you, gentlemen. It looks like we don't really have any other questions that I think we haven't covered, or if we haven't covered your question, we can certainly follow up with you later. We have an email address, webinars@ecolab.com. That's actually monitored by me, so very easily I will respond to that. So thank you very much for joining us today. We have been recording this webinar, as Gerald mentioned at the very beginning, and so we'll have that available on our website by next week. And our next webinar is in 2019. As I mentioned, this will be our last webinar for 2018, so I'd like to thank you all for attending so regularly. We usually have very, very good attendance at these. I think somebody asked a question if they were alone on the webinar, and the answer to that is no. There's a few hundred people on the line with you. So again, thank you very much for joining us today. One thing I do want to make sure you are aware of is I know a lot of people attend our webinars because they want continuing education certificates. There is a survey that will pop up when you log out that actually asks the question, do you want continuing education credits for this? And so you just check yes, and we will get those to you. Also, we appreciate any answers you have to the rest of that survey, because we also ask if there's other topics you want to hear about. So this was a topic some people had indicated last year at the end of the year that they had wanted to hear, so we added it to our calendar. So we are listening, and we do respond to that as well. So again, thank you very much for joining us today, and we look forward to speaking with you and learning more about your businesses and helping you have smooth operations in 2019. This concludes the webinar. Thank you.